Hi, my name is Alexis Robbins, and I'm the Senior Product Marketing Manager here at ExtraHop. Today, we're going to talk about a healthcare case study, Ransomware Revealed. Let's start off with the current state of ransomware attacks. The risk of falling prey to a ransomware attack is increasing as threat actors continually find smarter and sneakier ways to launch attacks and gain access to and hide in endpoints and networks. Ransomware attacks increased 70% over the last year and accounted for nearly 25% of all breaches in 2023, with payments topping $1 billion last year for the first time. We're also seeing organizations get hit multiple times. Organizations that have fallen victim to a ransomware attack are 6 times more likely to be targeted over and over again the next 3 months. 90% of our survey respondents in our current Global Cyber Confidence Index report suffering ransomware attacks, reported experiencing at least 2 additional ransomware incidents in the last year. So even when organizations pay the ransom, the attacks are not guaranteed to stop, and in some cases are more likely to reoccur if security vulnerabilities are not addressed. Now let's take a look at some of the healthcare stats. On the heels of Black Hat's attack on Change Healthcare, healthcare was among the top industries impacted by ransomware, with organizations averaging 9 incidents each last year. 91% of the survey respondents admit to paying the ransom in 2023, and consequently, respondents to our 2024 survey say ransomware attacks pose the greatest risk to their organization, 22% versus other threats. Last year was a particularly bad year for ransomware attacks. 141 hospitals were directly affected by ransomware attacks and experienced disruption due to the lack of access to their IT systems and patient data. Another concerning statistic is that 20% of typical healthcare organizations' total sensitive data holdings are impacted every time there is a successful ransomware attack. Compared to 6% for other organizations. So now let's talk about the healthcare case study and a recent win for us. So for Wood County Hospital, which has served the patients of Wood County, Ohio since 1951, their CIO was really concerned about securing patient information and avoiding disruptions to their operations. Over the years, their operations have expanded to include the main hospital, off-site medical offices, and 8 clinics supported by over 700 clinical administration and IT staff. The hospital is committed to providing the highest quality of care and patient experience. Protecting sensitive patient data and defending clinical systems from attacks on their healthcare providers were their top priorities. The hospital already had a fairly sophisticated security framework in place, including IDS, IPS, firewalls, and SIEM. While these tools helped protect the perimeter and alerted on potential threats, alert fatigue coupled with a lack of visibility into threats inside the network left Wood County with a crucial gap. So Wood County decided to evaluate ExtraHop alongside another network detection and response competitor. As the evaluation kicked off, one clear difference emerged. ExtraHop surfaced concrete insight and analytics right out of the box and without requiring any customization. And more importantly, ExtraHop was able to delineate the protocols and devices making those communications. Wood County ultimately chose ExtraHop for its granular visibility, reduced complexity, and ability to support healthcare industry-specific applications and protocols, and because of the faster time to value. Within days of deploying RevealX, a hospital employee reported seeing a message that looked suspicious. Sure enough, ExtraHop had already started alerting on the threat, which was a new strain of ransomware. With the information ExtraHop provided, the team was able to quickly identify and quarantine the affected machine, neutralizing the threat before it could impact Wood County's operations. This visibility set ExtraHop apart from the competition. While the other solution could provide some information about which machines the workstation was communicating with, didn't delineate the protocols and devices making those communications. Uncovering that information would have required manually reviewing logs and re-imaging machines. So let's talk about taking back control from attackers. Initial access can come from a number of different techniques, such as social engineering, like phishing, or leveraging a newly published CV vulnerability. Or maybe they are taking advantage of an initial access broker to get in the door. During this stage of an attack, the attacker has the advantage. They only have to be successful once, while defenders have to be effective 100% of the time at this stage. Once the initial intrusion is complete, though, the more recent variants of ransomware look for the current EDR in place to disable them and evade them. For days and sometimes weeks, attackers are living off the land and pivoting between different systems and gathering as much intel as they can, allowing them to gain more access with the final goal of extortion or a higher ransom. During this time, and luckily for us, every one of these tactics within the campaign are easily detected by RevealX, giving full awareness of the attacker's every move. Most vendors and organizations focus efforts on either the end of the kill chain while ignoring the middle post-compromise stages. However, we provide the most opportunities to detect attacks during this post-compromise stage, helping organizations stop attacks and avoid extortion and damaging data exfiltration. Now let's talk about the ultimate outcome of this case study. By going with ExtraHop, Wood County Hospital benefited by rapid identification and response to a ransomware attack in progress, and were able to take care of it in 2 weeks prior to them being notified by their service provider. So 2 weeks later, their service provider alerted them on this, and they were concerned that an attack was happening, and it was the exact same attack that they had already taken care of a few weeks ago. They also saw a savings of more than $70,000 per year in additional technical resources, and a greater time to value at less than half the price of competing solutions. And then following the successful implementation, the CIO stated that without ExtraHop, the investigation would have taken days or weeks, exposing the hospital to potential catastrophic risk. RevealX NDR's advanced behavioral threat detection quickly identified the threat, and then streamlined investigation workflows helped avert a major attack before it impacted patient data or clinical operations. Thank you for your time. If you'd like to learn more about ExtraHop and RevealX NDR, please visit our website or click the link in the post, and make sure to check out our latest Global Cyber Confidence Index report.